Dr. Alina Mitina is an emergency medicine specialist with Hackensack University Medical Center, part of Hackensack Meridian Health here in New Jersey. We say good morning, Dr. Mitina.
Hi, thanks for having me.
Thank you for coming on. And the reality is, a storm like this means a lot of people are going to need to shovel snow, obviously. Lisa Marie Fabo was just talking about this. You got a foot to 2 feet of heavy snow. This isn't light, fluffy stuff. The question is, when should we start shoveling, and who are the only people who should be?
People who should be shoveling are ones that are in pretty good physical shape. So what happens is that people who may not even do mild exercise every day go out into this very, very cold environment from a warm environment, start shoveling snow, doing this full body exercise. Their blood vessels constrict, their heart starts
Mhm.
pumping against these constricted blood vessels, and boom, you develop a heart attack. Anybody who's older has risk factors like high blood pressure, high cholesterol, diabetes should probably stay away from the snow. And of course, any cardiac risk factors.
Yeah, a buddy of mine used to be a cardiothoracic surgeon, and he used to do heart lung transplants. And I asked him, why is it so many people have heart attacks in the snow? And he was telling me that when you have the constriction of the blood vessels and you're pushing against that, you open yourself up for stroke. He was saying how if you think about it, putting the high pressure, think about it in terms of a hose, right? A high pressure pushing against plaques that are in those tiny vessels. That's when you shoot those plaques off, and that's when you have stroke. You could have the heart attack, you could have embolisms, all sorts of things happen. So if you are not in your 30s and 40s and in prime shape, and even if you are in your 30s and 40s in prime shape, don't push that. Don't try to take that huge lift of a shovel, little bits, a little at a time. You're better off probably, doctor, to tell me if I'm wrong, doing a couple of little passes as opposed to trying to push that big mountain of snow yourself.
100%. Please take breaks. I think that's the main thing I want to emphasize. If you have any, chest pain, you feel short of breath, you start developing any pain in your jaw, you feel unlike yourself, you feel dizzy, you want to pass out, you need to stop. You need to get inside into the warmth, take a couple moments. And if you still don't feel well, call 911. We're always here for you guys.
Amen to that. And just a quickie as we're wrapping this up, is there a way to minimize physical injuries other than the heart? We're talking about also muscle injuries, and people are going to be sore, I'm sure. How do you minimize straining muscles when you're out there doing the shoveling?
I think the main thing is warming up. It sounds a little silly, but maybe doing a few stretches, walking around your house or apartment, getting ready to go outside. Taking 5 to 10 minutes to do that is extremely important. And then after warming down, same thing. Take your time, lower your heart rate, stretch. I think that's the best thing. And remember, back injuries are super common. You want to
Mhm.
make sure that you lift with your legs, you don't overexert yourself because you don't want to worsen any injuries that are already present.
All right. And then kids too. We're sending kids out in the snow to play, but they get a little wild sometimes, right? So what advice do you have? I'm sure you see pediatric injuries too in the ER.
Yeah, 100%. I think the two main things I want to emphasize is wear helmets. Kids go sledding. It sounds kind of silly, but have them wear a helmet. There's so many kids that fall off sleds, hit their heads, and you don't want them in the ER getting unnecessary CAT scans, imaging of their heads. Also, make sure to dress them warm. Lots of gloves, lots and lots of layers, because frostbite is really common. Kids can have numbness and tingling of their hands, and they might not even know how to express that to you. And that could be really, really dangerous because it can lead to permanent nerve loss. So you have to go inside, keep them very, very warm. But again, the main thing is helmets and lots of layers.
All right. That's great advice. Dr. Alina Mitina, emergency medicine specialist with Hackensack University Medical Center. Plus, it's hard for the emergency vehicles to get through the snow. So, best bet, don't get hurt to begin with, right? Thank you
Definitely.
for coming on this morning, doctor. Stay warm.